So I just want to reiterate, what Dr. Flores-Uribe left off on, that, our hospital system today really is able to meet the demand. Right now, we've got 24% of our patients in ICU beds, and 13% of those patients are on ventilators. We've got the beds available to care for your needs now, but we all have to do our part to really limit the spread so that we don't end up in a situation for both our patients and our staff. And coming from a outpatient perspective, which is where I work, I am the lead family physician at Martin Luther King's Outpatient Center. I'm also a clinical assistant professor for Charles Roger University, where I also oversee the residency clinic for our training physicians here at MLK. In terms of services, we've noticed over the last 9 months some bit of a dip, in patients coming in and not knowing that we're open. And so I wanted to take this time to really encourage what I want our constituents and our residents of Los Angeles County to know is that Los Angeles County is here to provide services, outpatient and at the hospital. We are open. Our urgent care centers are still open, fairly regular hours. I know here at MLK, we're open 7 days a week from like 8 until midnight. We are still seeing every other medical condition that you may have, including COVID. And so we don't want anyone to stay at home thinking that we're not here to take care of your diabetes, to take care of your high blood pressure, to address your cholesterol or sexually transmitted diseases, and screening and birth control. We are here to provide still those services. Just a glimpse into some of the other services that Los Angeles County Department of Health Services can provide. Is actually going to be mental health services. Many of our facilities are co-located with mental health services, or they're nearby on campus. We also, like, for example, at my site, we have legal partnerships. So we have the ability to refer you for legal services for whatever may be coming up for your for issues related to COVID or issues related to no longer being able to work due to your job, losing your employment, or due to you getting the COVID infection. We also, regardless of immigration status, we're able to provide these services. So we don't want you to shy away if you are needing services, regardless of immigration status. In regards to the type of patients that we're hoping to see here in our outpatient services, we're hoping for anyone and everyone. Please remember to keep up with your preventative services. So your breast cancer screening, your cervical cancer screening, your colon cancer screening. This pandemic at some point will get better, and we want to make sure that we haven't neglected your health in this time. I have been concerned in the last 9 months myself personally that I haven't seen some of my patients. And when we reach out to them, they say, oh, we thought that you were closed. And so that's a myth. We're open. Please continue to take your medications. Please continue to take care of yourself and find creative ways to do so. One thing I've heard is that patients feel like they can't go outside and exercise. And so I tell them that the good thing is that they can put on some music at home and dance. And you don't have to leave the house. And so finding creative ways to still stay healthy and still take care of ourselves in the midst of this pandemic is really what I'm advising all of us to do, not just the patients, but the frontline employees, the reporters, everyone alike. In regards to things that I'm worried about over the last 9 months, seeing how this has happened, I'm really concerned that we simply still aren't taking it seriously enough. We're now at the worst point that we've experienced thus far in the pandemic, and it's really time that we take every single precaution that we can to protect not only ourselves, but every one of our loved ones. I look at this like it takes a village to raise a family, and it's going to take a village for us to get through this. And so what does that mean? That means physical distancing. That means making those small sacrifices right now so that we don't have to make them in a year from now. It means the hand hygiene. It means keeping your hands washed, keeping hand sanitizer, on you at all times. So literally, even at work, I have hand sanitizer that's on my ID badge. So I'm keeping it around me, not just expecting to see it, up around as I'm walking. Making sure that if you have symptoms that you get tested. I'll repeat that again because I can't emphasize the importance of that enough. If you have symptoms, please get tested. One myth is, oh, it's allergies. I just have a cough from the allergies. We're not here to guess about it. Let's know your status. Testing, as Dr. Flores-Uribe has said, is widely available. My site is one of the sites here that offers walk-up testing, and so that is available for any and everyone, regardless of immigration status, regardless of language, and regardless of insurance as well. We can take care of this for you. The other thing I'm worried about is hospitalizations moving forward. So Dr. Flores-Uribe gave a very detailed report on our data. Thank you. And the one thing that I want to say is our flu shot, influenza. That is something that we're worried about moving into the flu season. The flu shot is something that I am highly encouraging every Los Angeles County resident to consider getting this year and to actually get. We already got our flu shot. I got mine myself. I get the myth that people say, well, it makes me sick or I'll die from it. People die from the flu, not from getting the flu shot. We're worried this year that as COVID hospitalizations continue to rise, as we're seeing, that hospitalizations due to influenza may take away some of the beds that we'll have available for patients that are impacted by COVID. And so I am urging every person to get their flu shot this year. Flu shots are also readily available at Los Angeles County facilities, my facility included. You can get them also at local pharmacies. Call your provider, come to a local Los Angeles County facility, or feel free to go to your pharmacy, but get your flu shot like yesterday. And then the last thing I wanted to talk about briefly is COVID fatigue. So we're all exhausted, as a frontline worker, as an outpatient provider. I see the long-term effects that this is taking on patients, the depression that has happened, especially in our elderly population, where they're not able to see their grandchildren. They've missed the holidays. They're now they're not able to socialize with their friends the way that they used to. I had one patient that used to, an 80-year-old that used to go and walk up the hill and down the hill to get lottery tickets every day. And to see the decline in his happiness and his emotions it was devastating. It's broken my heart. And I see so many of those countless stories, so similar to that, time and time again, that, I just want us to know that if we do our parts now as part of the village, that in a year or two from now, we'll be back to a new normal that's closer to what we were last year. Frontline workers, we're not immune to the fatigue. You may see the smile on my face, but I'm not immune to it either. My grandmother will be having her 80th birthday in about a month, and we were very excited, and we've been planning that over the last year and a half. And literally, we're having to cancel those plans. I can't even travel to hug her. And she's someone who raised me as a daughter of a teen mom and a daughter of a nurse. See my family. I live here in Los Angeles, and my mother's here, but the rest of my family lives in other places. And so, we're not alone. We too share in the experiences of we're having to stay at home and not working. Black Friday is a thing that I've enjoyed for the last 20 years of my life, that I stayed at home for the first time ever. So we're in this together. Know that, frontline employees, and I just want to say thank you, not only to the doctors and nurses, but thank you to the custodians, thank you to the clerks, thank you to the secretaries that make this all work for us. We're really in this together. And if we continue and do more of our part, I think that we're all going to be okay in the end.